Welcome, everyone, to this incredible event, the Nutrition Innovation Lab 10-year legacy event. My name is Dariush Mozaffarian. I'm the Dean of the Friedman School of Nutrition Science and Policy at Tufts University. I'm really honored and proud to be able to welcome everyone from our community, all our collaborators, and many more, including guests from around the world, to this exciting two-day event. We're going to be aiming to share findings, insights, and reflections from a decade of work by faculty, staff, and students at the Friedman School and our many partners on the Feed the Future Innovation Lab for Nutrition. It's really been an honor for the Friedman School to host and manage this incredible activity, this huge activity supported over 10 years by USAID since its inception. Now, many such activities typically might be supported by a large state school or a land grant school, but as a small public graduate school that really focuses on the intersections of nutrition, science, and policy, we have broken that mold, taken on this responsibility very seriously. And the intersections and endeavors pursued by this innovation lab actually reflect our DNA and our name. We are a school of nutrition, science, and policy. The agenda of the Nutrition Innovation Lab has been to produce new science, things like studying mycotoxins in pregnant women's blood, environmental dysfunction of the gut in children, inflammatory markers, generating really cutting-edge empirical evidence on what works, multisectoral interventions, multisectoral programming that engage stakeholders for better food and nutrition, and engaging with policymakers, thought leaders, and governments across Africa and Asia. Sustained public impact can only be attained by really linking the best sound science with sound policy with smart policymakers. And now, obviously, we did not do this alone. We are the host of this incredible project. We are the management team collaborating closely with our consortium partners, including in the United States, many, but including Harvard, Johns Hopkins, Tuskegee, and Purdue in particular, many dozens of other institutions around the world, and of course, USAID missions and individuals globally. I'm sure you'll see and be excited by the end of this 2 days what this body of work has produced. It's very impressive, very remarkable. And I think beyond what's been achieved and what's been learned, we can also take stock of what's next. How do we now move forward to address malnutrition in all its forms, undernutrition, chronic diseases, and more? So I wish everyone a fabulous 2 days of critical thinking and discussion, thoughtful reflections on where and how USAID and donors should focus their work to actually improve malnutrition in all its forms. So thank you for attending. I'm really pleased to introduce my faculty colleague, my friend, my inspiration in many ways for the work that he does, Patrick Webb. Dr. Patrick Webb is the Alexander McFarland Professor of Nutrition at the Friedman School. He is the director of the Feed the Future Innovation Lab for Nutrition, and he's also the principal investigator of USAID's Food Aid Quality Review Project. Before he came to Tufts about 16 years ago, he was the chief of nutrition at the United Nations World Food Program. And so he's uniquely experienced, uniquely skilled to be able to lead and host such an incredible multi-institutional effort. So Dr. Webb, I turn it over to you.
So much, Dean Mozaffarian, Dari, kind words, much appreciated and right to the point. Welcome everyone to this legacy event. Legacy event sounds a little dry. This is a chance to take stock in terms of all the activities from science to capacity building to engagement to innovation that have been achieved over these past 10 years, but everything is forward-looking. This is not a time to sit on our laurels, be they many. It's a time to figure out, right, what have we learned? How influential, how important, how significant are these findings, these activities, these engagements around the world? And how can they inform what comes next? Because there has to be what comes next. The challenges of agriculture, climate, poverty all remain. They are the context in which the Innovation Lab for Nutrition has been working through these 10 years, but with a clear focus on the pathways by which interventions relating to food in all its dimensions, from agricultural production, through value chain activities, to the consumer and post-consumer, where can we innovate? Where can we do things better to achieve cost-effective impact that is measurable, impact that is meaningful? And that's really what we're focusing on in these couple of days. You're going to hear a lot of detail from a lot of the collaborators, not all of them by any means, over these couple of days. But we're going to kick off first with a few remarks from USAID, the principal donor under this Feed the Future initiative. And we're just thrilled to have Megan Rhodes give a few comments up front. She's the division chief for Nutrition Technical Services in the Bureau for Resilience and Food Security. And Megan has a long experience of public health and development experience. She only joined the Bureau of Resilience and Food Security in February 2020, so just over a year and a half, to be division chief. But she's worked in over a dozen countries, including 3 years as a health officer in Uganda. So Megan has a Master of Science in Health and Social Behavior from Harvard School of Public Health, and a Master of Arts in National Security and Strategic Studies from the US Naval War College. So really happy to have you here, Megan, and over to you.
Good morning and good afternoon, and thank you, Dr. Webb, for that warm introduction. I want to extend a special welcome to my colleagues and partners joining us from around the globe today. A brighter and more nutritious future for children everywhere is a central tenet of the Feed the Future initiative's vision. And it's my pleasure to join you today to kick off this legacy event as we look back on the Nutrition Innovation Lab's vital contribution towards that vision, so that we can look forward towards improving that future. The Feed the Future Nutrition Innovation Lab is a testament to how USAID and Feed the Future prioritized nutrition in 2010 when the lab was launched. I remember when the Nutrition Innovation Lab was launched because I was working in Kampala at the time for USAID, trying to get this new Feed the Future initiative off the ground. And as a health officer, I remember the challenges and the possibilities of harnessing the power of our public health evidence with our agriculture programming experience to try to improve nutrition as we sought to alleviate poverty. And many of the leaders of the Nutrition Innovation Lab were our earliest partners in that endeavor. And globally, as it was in Uganda and has been over the last decade, the Nutrition Innovation Lab has been absolutely instrumental in driving nutrition outcomes and advocating to keep nutrition elevated as a critical issue, both domestically and globally. Thanks to their clear vision and their dynamic leadership, the Nutrition Innovation Lab achieved many significant results, particularly in supporting groundbreaking research that has deepened USAID's and the world's understanding of how to address the challenge of malnutrition through pathways that have expanded beyond previous conventional wisdom. For example, the Nutrition Innovation Lab's work on naturally occurring toxins, such as aflatoxin, that can contribute to poor nutritional outcomes, really helped pave the way for USAID's own investment in food safety as a critical component of delivering on nutrition through the food system, and increased understanding of the role of food safety beyond it being a simple trade issue. Research connections and investments like those fostered by the Nutrition Innovation Lab help protect farmers and families abroad, here and at home, from some of the dynamic and unforeseen challenges that we face in ensuring a safe and nutritious food supply. To summarize very briefly a decade of evidence generation, the Nutrition Innovation Lab has contributed to strengthening USAID's nutrition work in 4 key areas. First, the lab's research has built a rigorous evidence base for multi-sectoral programming, nutrition-sensitive agriculture interventions, and food safety. USAID and its partners draw from this body of evidence as a key source of information to develop effective nutrition programs. Second, the lab has built skills and capacity. This has included more than 140 technical trainings, skills labs, workshops, It's reached more than 6,000 individuals with tangible skills and the tools needed to support locally designed nutrition solutions. One example of this is how the lab helped to establish the first ever dietetics program in Malawi. And as cohorts emerged from that program, the government of Malawi has created new dietitian positions within the government hospitals and dedicated resources within the national budget to support the program's sustainability. Third, the lab disseminated their findings and engaged with policymakers, with practitioners, with donors, with the scientific community, and with private sector innovators to support application and ownership of this research, while also continuing to elevate nutrition on the global agenda. Finally, the lab has helped us measure our work in nutrition. The lab's initiatives around metric development supported new ways to measure the impacts of nutrition interventions, which are absolutely foundational to our ability to track progress and hold ourselves accountable. Overall, the Nutrition Innovation Lab, it really epitomizes how science can be effectively translated into practice, and that this translation into practice is best achieved in partnership with local partners who are essential leaders and investors in their own actionable nutrition science and the use of its findings. I do want to close with a final thank you to the Innovation Lab for their partnership and leadership over the past decade. We have all come a long way since those early consultations in Uganda, and the next 2 days will showcase the important learning and development that has been made over the past decade that will help inform the next decade. I invite you all to actively engage in the discussions over the next 2 days so that we can leverage from the lab as much as possible as we all strive towards our common vision of a brighter and more nutritious future. Thanks very much, Patrick. Back to you.
Well, thank you, Megan. That amazing few minutes of really substantive words and warm words at that. So thank you. And it just shows how far we've come together, clearly. I remember those early days in Uganda, and here we are now. And of course, so much more to be done in so many areas. Now it's to introduce what as one of the major areas we could do more in. It's my great pleasure to introduce Dr. Shakuntala Thilsted to kick off with a keynote. There's so much we could say about Shakuntala. Most of you know her. She's a champion of all things aquatic, as you can see from her background. So deservedly, she's this year's upcoming 2021 World Food Prize laureate for her groundbreaking work and promotion of aquatic food systems, including aquaculture and capture fisheries, all things relating to that. But in addition, she's a member of the steering committee of the high-level panel of experts on food security and nutrition of the Committee on World Food Security, and serves as vice chair of the UN Food Systems Summit Action Track 4, which is all about advancing equitable livelihoods. Dr. Thilsted has a PhD from the Royal Veterinary and Agricultural University. Now it's called the Faculty of Life Sciences in the University of Copenhagen in Denmark. Has a doctorate, an honorary doctorate from the Swedish University of Agricultural Sciences, and she was just awarded the 2021 ARL Global Food Innovation Prize from Guelph. And finally, Shakuntala is not only a good friend, but she's been a sustained supporter of this innovation lab from the very beginning as a technical advisor. So it's fitting, and we're so happy to have you, Shakuntala, start us off. So over to you.
Thank you so much, Patrick, for inviting me to address this legacy event of the Feed the Future Innovation Lab for Nutrition. As you said, I have been associated with the lab from its very beginning, and even before, when the formulation of Feed the Future initiative was done in USAID. So it gives me great pleasure to reflect on the achievements and successes of the Nutrition Innovation Lab over the last decade. There's so much, so I'll take tidbits of it and put them in context of what I call transforming food systems for nourishing people, nations, and our planet, building on scientific evidence. Let me begin with the global perspective and narrative. drawing on some of the global platforms you mentioned in which I'm engaged, and link these to some of the examples of scientific evidence generated by the lab. As many of you know, I have worked a lot in Bangladesh and some in the Terai and Nepal. Therefore, I would lean on these findings and lessons from these regions that were generated by the lab. We are now less than 2 weeks away from the UN Food Systems Summit, where important solutions, decisions, and policies will be adopted by UN member states and a variety of stakeholders to bring about transformation in our food, land, and water systems. Underlying the solutions and actions recommended for transformation is the importance of sound scientific evidence and data so that we can justify the investments and suitability for adoption and adaptation. As we are aware, we are only 9 seasons away from the 2030 and reaching the targets of the Sustainable Development Goals, especially SDG 2, Zero Hunger, which I know you, Patrick, are so much engaged in. The latest State of the Food Security and Nutrition Report in the world, SOFI, indicated that the number of people facing hunger is on the rise. And alone, if you would compare it to the 2019 figure, at least 118 million more people have been added to this group. The COVID-19 pandemic brought about unprecedented disruptions as to how we produce, access, afford, and consume food. And as the effects from the pandemic are long-lasting, they can be further compounded through the intergenerational effects of malnutrition. So where are we on our targets to reducing malnutrition? As many children, especially in low and middle income countries across Asia, Africa, and Latin America, that's where you have great population numbers and many undernourished. And there is, just to give an example, that the lab has worked on adolescent girls and adult women suffering from anemia. And on the other hand, the rates of obesity and overweight in both adults and children are on a steep rise. In the past decade, the lab has worked in several countries, for example, Bangladesh, Nepal, Timor-Leste, Ethiopia, Malawi, Tanzania, and Uganda, all countries in which to build research and academic capacity to conduct research to address food and nutrition security. Through strategic investments and guidance, the lab empowered researchers, academics, students, and practitioners in these countries to develop sound, science-based policies and framework across various disciplines, including food and nutrition, socioeconomic equity, and environmental production. I was involved in some of the discussions and mentoring of some students and staff, and therefore it is with great pleasure I can draw on these examples, especially from aquatic food systems. In Bangladesh, groundbreaking research was conducted by the lab on assessing the impact of nutrition-sensitive aquatic food systems in enabling better access to diverse, nutritious, and safe aquatic foods, focusing on small fish, as well as improved livelihoods, increasing income and gender equity. The lab assessed the impact of pond polyculture and vegetable growing in homestead production systems that led to significant improvements in diet quality of household members. In Nepal, research shows how seasonality, culture, and socioeconomic status of households impact on child nutrition through the consumption of vegetables, dairy, meat, and fish that varied by agroecological zone. Through this research, we learned the importance of these factors and that we must take into account season, location, food environment, and culture in how we assess data, diets, and develop dietary strategies. A very important contribution of the lab has been the generation of disaggregated data by social groups, sex, and age. The lab has developed appropriate methodologies for collecting disaggregated data in its field research. It has also demonstrated that scientific methods can be used to derive individual data from household data and has used this in many of its research. This is crucial, understanding the factors that impact upon nutrition, then finding the solutions and further implementing interventions for positive change can only happen if the scientific evidence used is context-specific and disaggregated. And I hope, Patrick, you have loads, you and your team, you have loads of data. I hope we see much more data come out so that we can use these also in the solutions that are coming forward in the UN Food Systems Summit. As we move forwards, we must acknowledge the significant contribution of the lab in providing deeper insights and greater understanding on the various factors that impact our work and the importance of disaggregated data and knowledge for designing solutions that are impactful. This is especially important as nations and countries are starting to build forward better in the wake of the COVID-19 disruption. They are emerging from unprecedented shocks, and this is a great opportunity to position strategies that can transform food systems within nations. And we have seen this already with some of the data that I have used from the lab in our HLP reports. This data and science-based evidence are necessary to guide policymakers to design policies and investments that maximize the impact with lower economic and environmental and social costs, making the solutions sustainable. One such policy change that can benefit from the work of the lab is the revision and better diversification of foods in national food-based dietary guidelines. This change will move procurement and inclusion of nutritious and safe foods into public programs, such as school feeding. School feeding has been identified as one of the solutions in the UN Food Systems Summit. Mother and child healthcare programs, social safety nets, and other nutrition and health programs, all very important now in the wake of COVID-19. It is important for us to incorporate indigenous and traditional knowledge with modern innovations, and the lab has paved the way in this direction. By working directly with communities and other stakeholders, we see the potential of harnessing indigenous understanding of factors such as seasonality, biodiversity, traditional consumption patterns, and create bridges to incorporate this knowledge together with modern innovations. It is through this work that we create opportunities, especially for women and youth, to be included and actively participate in food systems transformation. I look very much forward to the commencement of the Feed the Future Innovation Lab for Food Systems for Nutrition and the scientific evidence that will be generated further for transforming food, land, and water systems to nourish all people and our planet. Thank you so much for inviting me to address all of you on this 10 years legacy event of the Feed the Future Innovation Lab for Nutrition. Thank you, Patrick.
Thank you, Shakuntala. Wonderful comments, really drawn from both experience and the passion you have for not just the science and getting the science right, but translating that into something real on the ground for the people who need it most. And that's a shared passion. So we're very grateful that you took the time to share your comments and experience with us today. So it's now my turn. I am going to try and give a little bit of an overview. Many people have been involved in the Innovation Lab's work over these 10 years, often in different parts of the agenda, the parts of the activity. Not everyone has seen the big picture, the overall package, and that is what I'm going to try and share with you over the next half an hour or so, a way to summarize 10 years in just a few minutes. So I am sharing my screen, and what we will hopefully be able to see is a presentation which riffs on this theme of looking backwards, but also looking forward to the future. So a decade of Innovation Lab. So I think the Dean has gone now, so I'm going to loosen my tie, ready for this presentation, because I'm going to have to speed up. Right, what was the world like in 2010? Well, most of us were a lot younger and looked a lot younger and a lot grayer in the meantime. But around a decade ago, it was a time when a lot of focus had come to bear on nutrition. The term nutrition sensitive had yet to be specifically coined, but there was an understanding that what was being done at that time was simply not enough, that the burdens, not just of stunting, but of malnutrition in all its forms, were intolerable, but that we needed more evidence. We needed more to convince more policymakers with rigorous evidence that things could be done differently. And there was an outpouring of reviews and assessments of the extent, the information that existed at that period, and most of them focused on the lack of reliable information on pathways and mechanisms, on how agriculture, if you invest in agriculture in different forms, including aquatic systems, can it translate all the way through to improve nutrition outcomes, measurable outcomes. And part of the debate was that actually we're not even sure we didn't have the data. We didn't necessarily even have the approaches, the methodologies, the study designs that would allow us to answer the right questions. There was the famous review of literature in 2011, which found many tens of thousands of reports talking about agriculture to nutrition and health outcomes, but only a handful of those actually had rigorous basis for what they recommended. I pulled this slide out from a presentation I made literally 10 years ago to try and explain some of the questions. And the Innovation Lab was originally called a Collaborative Research Support Program, a CRISP, became an Innovation Lab. And I was actually surprised when I pulled this out, how many question marks we had about pathways and mechanisms relating not just to nutrition outcomes, but the quality of diets and the mechanisms by which stunting, for example, could be affected through wash, through gut dysfunction, and so on. So the program of activity that the Innovation Lab engaged in was essentially an interlocking cube that involved at least these 4 domains: rigorous research on a range of activities, focusing primarily on deep dives in Nepal and Uganda, and you've heard some of the mention of those, but that mushroomed out to over a dozen countries over time as more and more missions and more partners asked us to engage with them. So engagement was a major part of this. Research without engagement often means that reports stay on the shelf, and that was the last thing we were willing to accept. We also focused heavily on building capacity within countries, within the host countries, among partners, helping support, capacity of institutions as well as individuals, to try and build up the capabilities in country to pursue both the research and engagement that we were talking about. And then metrics innovations is just one of the special domains that we were engaged in, and I'd like to talk about, because we also looked at things like novel technologies. There are a lot of innovations in implementation that we looked at, but you'll be hearing some of the metrics work later today. So let me just talk a little bit about these four, starting with research, not going into huge detail, but giving the overview. So on research, we started very much focused on answering questions in the pathways along agriculture to nutrition, trying to flesh out what we could answer empirically, where the questions remain, and what kinds of guidance could we give to both policymakers and program designers for the windows of intervention, places to make the most cost-effective difference. Biological mechanisms, that relates to some of the things mentioned earlier about mycotoxins, so aflatoxin and other mycotoxins, on foodborne diseases, how that impacts not just on health, but explicitly on nutrition. And then technologies and metrics innovations, technologies like solar drying, chimney dryers, and cool rooms to try and preserve nutrient-rich foods, which are often the most perishable, but often contributing the most to diets. So I'm not going to focus so much on the results. You're going to be hearing about those, but how? Why was our approach important? And one of them was that these were not small studies. We did a huge investment in large samples, which with more power allow for not just stronger results, but more reliable and trustworthy results, which were some of the things highlighted in the reviews 10 years ago, that the studies were not powered to give responses. And so what you're seeing here is we had multiple longitudinal panels. We had birth cohorts that followed pregnant women through pregnancy and followed those children up to a year or more of age. These allowed us to have so many data points, 10,000 households plus in Nepal across the different studies, 8,000 in Uganda and so on, 3,000 in Bangladesh. This is the way to generate more significant results and to follow what happens over time. These are not snapshots. These kinds of studies allow us to delve deeply into what's really happening on the ground. Some of the things that Shakuntala was talking about. One of the domains was, for example, multi-sector programming. Can programs that focus on agriculture plus additional activities actually impact on nutrition? And that's a very complex type of question to try and answer. RCTs are very good at answering one intervention on one outcome. Multi-sector programming requires us to look at a bigger universe of activities, RCTs being randomized controlled trials, of which we also did a few. And what we found, this is across countries like Nepal and Uganda, but also Bangladesh and other countries, multi-sector programming that involved agriculture, water and sanitation and hygiene activities, financial literacy and empowerment of women, market access, marketing literacy, and social and behavior change communications, for example. We did see improved farming practices adopted across a wide range of types of farming activities. We did see the production envelope diversified with particularly more livestock species, and linking horticulture with aquaculture, for example. So combining different approaches to agriculture did increase income. Households did join groups, take loans, and we did see women's empowerment through improved involvement directly in cash cropping. All of that raised income, but it also raised households' engagement with market processes, both purchasing improved inputs and engaging with sales, and often seeking out markets more distant than their own farm gate or local markets, going to markets, investing in transportation to improve the price that could be obtained, particularly for high demand, high value crops. Now, the growing of high demand, high value crops actually improved own production among those households that produced, whether it was animal source foods or fish production of various kinds, including fish production of various kinds, or legumes or fruits and veg. Improved diets in these households came both from production and market engagement. By selling more, they were able also to purchase more. And we see measurably improvements in women's diet diversity, diet quality, and sustained intake over time by children of at least 2 animal source foods. And we documented that at least 2 animal source foods in the child's diet sustained over time was independently significantly associated with less stunting in Bangladesh and Nepal. This is really important information on the pathways. Now, it's not always the case. Multi-sector programming impacts on nutrition. We can see it over time, but sometimes the effects take time. And often it may take at least 2 years. We see the impacts on the child once they are eating an improved diet from the family pot over two years of age, over 24 months. But we can also see cognitive outcomes and see birth outcomes. And that's one thing that will come out significantly over these 2 days, that a lot of the multi-sector programming activities have impacts on maternal diets, which improve a range of birth outcomes, which then set children on the right pathway for nutrition. So this slide is theoretical, but it's simply trying to suggest that different sector interventions, they can work in both singly and together, their combined effects, but they take time often to build on each other synergistically and achieve the results that we want. So the time horizon of programming needs to be carefully thought through. And the effects on stunting can also take time, on nutrition more generally, but stunting in particular. And it may take a while before you start seeing those effects. So we have to moderate our expectations and calibrate according to the types of interventions. But at the end of the day, we were able to demonstrate that there are significant pathways from agriculture to nutrition through diets, income, markets, and so on. They are sustained, but they are nuanced, and we have to be careful about that. Now, biological mechanisms required us to delve into the science, look very closely at blood, urine samples, stool samples, and that involves a host of other challenges of cold chain and labs. But some important findings have come out of the range of studies. Maternal environmental enteric dysfunction, which means gut disorder, has measurable and independent effects on gestation time, and the baby that is born, either small for gestational age or low birth weight, is often also stunted at birth. And therefore we have to look very closely at the WASH component of these programs. Maternal aflatoxin, that's AFB1, is independently and significantly associated also with small for gestational age, SGA, with baby stunting at birth, but also with low weight for age, Z-score, at birth, and low head circumference, right? So we've been able to tease out a range of birth outcome effects that are really important, really problematic, and we need to therefore really focus our 1,000 days thinking very much further upstream to the maternal condition. But once the child is born, the child having aflatoxin in his or her blood is also associated with other mycotoxins. So there's something going on in the food. The food environment needs to be cleaned up to get rid of this, and also associated with higher gut dysfunction, which means nutrients going in may not be working because they are coming out as well. Now, child aflatoxin at birth associated with lower weight of that same child 3 months later, and lower weight for height z-score, so growth at 6 months of age, right? So we're seeing effects both in the mother and then in the child as the child grows. And the child's own environmental enteric dysfunction is associated separately, independently, with poor linear growth, so stunting, with high DON. I won't try and say that particular word, but it's one additional mycotoxin, and low iron status. So there's a lot of different interactions going on here, not at the community level, but within the gut, within the body, the biological mechanisms and pathways that we've been able to elaborate on, but for which we still need to know more. Now, that has direct linkages in cleaning up the food system, for example, with food storage and processing and how the value chain works, for example. And while the effects of drying and improved storage mechanism like hermetically sealed bags may have limited effects, we were able to show independently that the adoption of different mechanisms for processing and storing of foods is associated with changes in child diet diversity and height for age z-score, right? Small effects, but measurable effects. And this is how the biological mechanisms can inform the importance of adoption and innovations in the value chain. So quickly moving on, that research also involved capacity building. We're very proud of the PhDs and master's degrees, obviously, and we worked with a huge range of academic partners around the world, but very happy to also involve lots of individuals around the world, professionals, not just academics, policymakers, influencers of various kinds, through workshops and trainings on study methods and so on, and helping the rest of the Innovation Lab universe on their work relating to nutrition. Now, the publications, absolutely important. There's no question that, these are just our publications for 2020, but these are not the end. These are a means to the end, and you wouldn't achieve the impact if you left it to the publications. They are important for demonstrating the rigor and building the evidence base, but they are not alone. So we were building capacity through the research process from study design to publication. So the lab has at least 140 peer-reviewed publications so far, with many more still in the pipeline. They will still come out after the end of this particular lab, involving almost 100 non-US co-authors. This is part of the agenda. 63 of those in Asia, others in Sub-Saharan Africa and Middle East, North Africa. On a range of different topics, right? This is not just one topic, given the range of our activities, different topic domains. So building the evidence base, but by doing it through building capacity. Some of the innovations you'll hear about later, including one on nutrition governance, but energy expenditure, cell phone use as proxies, resilience metrics, and so on. And also testing whether you can collect dried blood spots instead of shipping serum samples around the world to assess aflatoxin in the blood. On energy measurement, we experimented with accelerometers. You can see on this woman's waist a small Fitbit type of measure to measure energy expenditure. Measuring diet quality is one thing, but expenditure of energy also matters, where we can see for different activities across an agricultural season, men and women have different expenditure of energy patterns depending on the technologies, the activities, their health. And we need to know more about this aspect of nutrition. And the Nutrition Governance Index that I will be talking about later, where we've looked at how effective, what is the quality of implementation of programs or policies. We created a governance index, which we found, if you monitor it over time, is directly linked to improved measurement of stunting over time in the places where the quality of implementation was higher versus low. So these are innovations that allow us to talk differently about nutrition, not just as a problem, but as a much bigger issue in the livelihoods and policy universe of countries in which we work. So that allows us to engage with researchers on the ground, policymakers, donors on the ground, to achieved impact by bringing this evidence, but by talking differently about nutrition. A few examples here. It was mentioned by Megan, building accreditation, building diet composition tables for the first time for Malawi, and then helping the government create its first ever own homegrown dietetics program, which the government then created jobs in all the hospitals to absorb the graduates from that program. This is sustained impact. It's a real win. Bangalore in India, a partner with the BBNC you'll hear about, the Boston Bangalore Nutrition Collaborative, where individuals were trained on research design to be more effective in their own work from across Africa and Asia. In Nepal, our work on mycotoxins was mentioned, which catalyzed the government to ask us to support cross-ministry thinking and strategy building around food safety. How can Nepal better create an environment with clean food more broadly? We worked closely with other innovation labs, horticulture and post-harvest losses in particular, and supported also the conceptual thinking of the current Bureau of Resilience and Food Security on their food systems framework. So this involved partnership. It involved so many different partners, other labs in different parts of the world, working directly on the ground with them. It involved a lot of USAID engagement from missions and regional bureaus, and brought in additional funding, actually engaged with and leveraged work from other donors and other partners around the world, which obviously couldn't have been done without the engagement of so many partners. These are hopefully most of them. But what you see here is actually a national and global commitment to this agenda of building the empirical evidence base to support improved policy and practice, building capacity, and leaving behind, once this project ends in a couple of weeks, the thinking and the willingness to push forward on an agenda where improved nutrition is the common goal. I know this is a bit hokey, but I think it is important. You know, I personally see a lot of the keys to the Nutrition and Innovation Lab's success being really these four things: teamwork, this partnership, but with a common vision, an understanding of where we're trying to go, and sticking to it, including the second one, commitment to rigor in all dimensions. It involves rigor in training, rigor in the science, rigor in support of policy making. That is translation of science. It's translational work that's so super important in all of this. And we are needing to move from translation of science to policy engagement. All of this can be done and must be done. Finally, the forward-looking dimension. I'm getting echoes here, sorry. This is my final slide. The food systems dimension is now embraced fully by USAID with its new conceptual framework. This is partly a reflection of the broadening of our understanding of how nutrition sits very much with resilience, with environmental systems, with biological systems, and food systems more broadly. We have to think very carefully about where do we focus next? What are the investment levers that we can pull to improve nutrition in this conceptual framework, where there are multiple drivers and different kinds of investments, new investments that could be made now that we know more about the pathways that directly lead to nutrition. There are market level actions of all kinds that are going to be needed. The role of markets shone through really importantly in this lab's work over time. The food environment now becomes really critical globally. The location, the context in which consumers access their food, whether they purchase it or in other ways, shaping, influencing the food environment for improved nutrition, top of the agenda. Food safety, not just mycotoxins, but all forms of mycotoxins, and how that can be shaped both by improved national policies, but also food system technologies on the farm, in the marketplace, and in the private sector, and beyond stunting. Stunting is absolutely essential. We have to do more to reduce the burden of stunting in all the Feed the Future countries. But we have to understand nutrition in its broader sense, including some cognitive dimensions, including gut function dimensions, as well as the micronutrient quality. This all matters. And so I end there, hopefully being able to have given you a snapshot of the past, a snapshot of thinking about the future, and the basis on which we can now go forward over these 2 days in thinking about what have we learned, how significant is it, what does it matter for policymaking and practice, and how does it shape our thinking of the future. So I'm going to end there. We will have just a couple of minutes, if we like, for a biological break, but we will be moving swiftly. If the chair, our great friend and collaborator, Professor Wafai Fauzi, wants to initiate early, but I think we should probably wait until 9 and take this into the first full session of our Innovation Lab activities. So I thank you all for participating, not just in this session. I encourage everyone to participate in as much of these 2 days as you can, including in the final session, which on day 2, tomorrow afternoon around lunchtime, US time, we will have a high-level roundtable that will be moderated by Aisha House, which will include a senior policymaker from Nepal, senior project staff from USAID, but starting with some messages from Senator Markey and Congressman Jim Mcgovern from Congress, who will reflect on the importance of supporting this kind of activity over time. So I'm going to end here and pass it back to the organizers, and we'll talk to you later. Thank you for your attention.